cancer. The word evokes fear and uncertainty, affecting millions worldwide. It's a diagnosis that changes lives in an instant, bringing with it a wave of emotional and physical challenges. Nearly 10 million deaths in 2020 were attributed to cancer, according to the World Health Organization. This staggering number highlights the urgent need for better prevention and treatment strategies. Early detection significantly increases the chances of successful treatment and survival. It allows for timely intervention, which can make all the difference in a patient's prognosis. Yet, in many resource-constrained settings, diagnosis often comes too late. Limited access to advanced medical technology and trained professionals exacerbates the problem. The high cost of traditional diagnostic methods poses a significant barrier to early detection. Many families are forced to choose between financial stability and life-saving medical care. We need a paradigm shift in how we approach cancer detection, prioritizing affordability and accessibility. Innovative solutions and community-based approaches could bridge the gap. Imagine a world where a simple, affordable test could detect cancer early, saving countless lives. This vision is within our reach if we commit to making it a reality. Imagine a test as easy to use as a home pregnancy test, but with the power to detect early signs of cancer. This could be a game changer in the medical field. Affordable cancer test kits could revolutionize diagnosis and treatment, especially in low-resource settings where access to advanced medical facilities is limited. These kits could leverage innovative technologies to analyze samples like saliva, urine, or a drop of blood, making the process simple and non-invasive. Rapid results would provide crucial health information within minutes, allowing for timely medical intervention and peace of mind. In remote and underserved communities, these kits could serve as the first line of defense against cancer, bringing essential healthcare to those who need it most. They could empower individuals to take charge of their health, breaking down barriers to early diagnosis and fostering a proactive approach to wellness. These kits could also monitor treatment response, ensuring patients receive the most effective care tailored to their needs, improving outcomes and quality of life. Translating the vision of affordable cancer test kits into reality is a formidable challenge, requiring immense dedication and innovation from the scientific community. Cancer is a complex group of diseases, each with its own unique characteristics, making early detection a daunting task for medical professionals. Traditional methods often detect changes only when the disease is already advanced, limiting treatment options and outcomes. Early detection requires identifying subtle molecular changes before symptoms appear, which is a significant scientific hurdle. These changes manifest as specific biomarkers in bodily fluids, such as blood, urine, or saliva. Developing these kits involves identifying sensitive biomarkers and creating accurate detection methods that can be reliably used in various settings. This requires advancements in nanotechnology and microfluidics, which allow for the precise manipulation and analysis of tiny biological samples. Kits must be easy to use and integrate seamlessly into existing healthcare systems, especially in resource-limited settings where access to advanced medical facilities is limited. Hope on the horizon. Innovations in low-cost cancer diagnostics. Researchers worldwide are developing affordable cancer detection technologies. In India, a low-cost paper-based test detects oral cancer from saliva. In China, a smartphone-based system detects cervical cancer using a vinegar test. These innovations leverage low-cost materials and technologies to create effective diagnostic tools. Combining scientific ingenuity with affordability can significantly address the global cancer burden. Nature's bounty, Nepal's medicinal plants, and the promise of affordable treatment. Nepal is home to a rich variety of medicinal plants with potent anti-cancer properties. Traditional healers have used these plants for centuries to treat ailments including cancer. Modern research validates the efficacy of these remedies, identifying compounds with anti-cancer activity. The Himalayan yew produces paclitaxel, a powerful chemotherapy drug. Xanthoxylum armatum contains compounds showing significant anti-cancer activity in laboratory studies.